relatively low, but they are really worried that Germany is going to squander the advantage that it managed to achieve over the last few months, getting the initial outbreak under control. We've seen these new numbers today. They represent a sharp increase on the previous day, more than 4,000 new cases. And so we are starting to see some restrictions gradually come into place. Yesterday, members of Germany's 16 states decided that people who live in so-called hotspots, high-risk areas where the number of cases exceeds 50 per 100,000 inhabitants, will no longer be able to go and stay overnight as tourists in hotels anywhere else in the country. The authorities have an eye to the autumn holidays, which are coming up here. Here in Berlin, there are restrictions on the sale of alcohol after a certain time at night. There are restrictions on the number of people who can gather at night. And that's because the authorities really are concerned about where these new increases are coming from, and they're pretty certain that this is all to do with people gathering. And they say they're not seeing infections coming from places like hairdressers, from public transport, not many infections breaking out actually in schools. The real problem seems to be when people get together for a religious gathering or for a big party, either inside or outside, where they're not observing social distancing, they're not wearing masks, and they're not ventilating the room. So the authorities are really trying to crack down on that as what they see as the real source of the problem at the moment, but they are concerned. The health minister this morning describing this as a character test for German society.
Jenny Hill in Berlin. Before the pandemic, accident and emergency departments in England saw more than 2 million patients a month. That figure plummeted during the height of the crisis to fewer than 900,000. Figures just released reveal the number of A&E attendances in September went back up to around 1.7 million. With emergency departments having to deal with a rise in both COVID and other cases, the Royal College of Emergency Medicine says it has significant concerns about the situation. It warns that crowding remains a major threat to patient and staff safety. Our health correspondent Mark Norman and cameraman Andrew Marshall have spent 24 hours filming a shift in the A&E department at East Surrey Hospital in Redhill to see how staff are coping there.
A&E staff have a challenge: how to deal with rising numbers of patients, identify who might be COVID positive, keep other patients virus free, keep staff safe, and of course treat patients quickly. It helps when at 7 a.m. the shift starts with the news the department haven't been busy overnight.
So we're walking into a good department. We've had patients moved on very quickly out of the department overnight, all bedded in the right place, which is a good thing. So we've got a really good start to the day.
Well, it might look like a pre-pandemic A&E. Since the start of the crisis, this department has been enlarged, reconfigured, and staff are now having to deal with new challenges, not least social distancing.
When you're with a patient, sometimes it obviously can be really difficult, so there's a couple of professionals together, but as much as possible we will keep our distance. So it's really important that we keep that within the hospital, and it's really quite a challenge actually.
So we're at the front door of the hospital, effectively. The ambulances come through there. They're expecting 5 ambulances in the next 15 minutes. And staff here trying to assess what sort of patients they've got and where they might have to go here in the emergency department. The first issue: could the patient possibly have COVID? If they might, then they're